Hi everyone, today we are presenting our project on using an RAG system to help understand and suggest treatments for psychiatric disorders. My name is Alima, my teammate is Ellen. This project is part of our NLP course. Our project builds an RAG system using trusted medical sources like DSM-5, ICD, and clinical guidelines to answer mental health questions accurately. Our goal is to let users ask psychiatric questions and compare three models, LLaMa, Mistral, and Phi3. This system can help improve diagnosis and make mental health support more accessible. Previous studies show that LLMs improve patient support and that RAG systems help provide accurate and up-to-date medical information. For example, Vanetel in 2024 found that integrating LLMs into patient support systems improved patient satisfaction and reduced negative emotions. Other research shows LLMs can identify mental health symptoms and that RAG systems can support diagnosis, though they still have limitations. Our system splits documents into chunks, converts them into embeddings, retrieves relevant information, and uses LLMs to generate accurate answers. We will deliver the report, system code, evaluation dataset, model comparison, slides, GitHub repo, and documentation. We evaluate our model using metrics like BLEU ROUGE, relevance, precision, and recall, and check if answers are accurate and aligned with clinical guidelines. We use BLEU and ROUGE scores to compare generated answers with reference responses. And for retrieval performance, we measure precision at K and recall at K to see how well the system retrieves relevant information.
This is our code for our RAG system for psychiatric documents. And we evaluate three different pre-trained models, Mistral, LLaMa, and Gemma. And we also evaluate them using a variety of different methods. So step one is ingesting the 5 source documents, and we did this using LangChain PDF. And the knowledge base is built from 5 psychiatric documents, including the DSM, which is the gold standard that clinicians use to diagnose psychiatric disorders. This is a full book. This is a full book as well. These are shorter guides, but still very long. So what we did was we used LangChain, the recursive text splitter, to chunk these into chunks of 1,000 to make it more manageable. We use the PubMedBERT embeddings, also known as BioBERT. This is the Hugging Face authentication that we used to access all 3 of these models. So we loaded all 3 models using 4-bit quantization, using bits and bytes. And this allowed us to store our data as 16-point floats, which reduces the VRAM substantially, allowing modeling to be a little bit quicker. We also wrapped each model in LangChain's retrieval question-answer chain, because that's what this project is doing. We're asking questions and we want to retrieve answers. And using the stuff strategy, it means that the retrieved chunks are concatenated directly into the prompt context. For Mistral, we also included specific stop tokens, just so that the model knows when the end of a sentence or a token is, or a phrase. Okay, and then again, we saved the model to Google Drive, so we don't have to keep downloading the model from Hugging Face every time, which takes ages. Moving on to our test questions, we actually included 17 questions spanning a variety of kind of topics in psychiatry. So we asked the typical questions of, how to diagnose major depressive disorder. We asked things like distinguishing between psychiatric disorders, which is very important for clinicians in real life. And then we also kind of ask more theoretical questions like how psychotherapy and pharmacology differs in effectiveness for treating depression. So we ask a whole range of questions to evaluate the performance of our 3 RAGs. And as you can see here, we specifically ask to provide a sources used section and to format based on the context, question, and what the helpful answer is. We do this exact same way for all 3 models except for Gemma, where we had to include an additional instruction to make sure it's in the correct mode. But other than that, they all loop through all of the questions and then invoke the question answering retrieval chain. And then we specifically split using regular expressions and recognition of the patterns. We specifically split the data so that we can extract the helpful answer and the sources used, which we then append to a data frame. And we do this for all 3 models. This is the data frame that is produced as a result of that loop. So we have the specific question, the Mistral answer, the sources and the retrieved reference, and as well as the BLEU and ROUGE scores. We used BLEU and ROUGE to see how different and similar the returned answers were to the actual context they were retrieved from. So these were computed internally against the actual retrieved reference chunks. And we did this for all 3 models. As you can see, there isn't really a significant difference in performance between the 3 models in terms of ROUGE or BLEU. They're all kind of performing at the same level. However, ROUGE is consistently higher than BLEU for all 3 models, which we captured in these post hoc tests. So this is for LLaMa. You can see ROUGE is greater than BLEU, Mistral, and for Gemma. And you can look at the p-values for the t-test, for the paired t-test. And this means that all models are successfully recalling the correct symptoms and clinical features, with ROUGE kind of between 0.2 and 0.25. So it's not huge. We might want to see that a little bit greater. But they're also not just regurgitating everything back in the exact same text format, particularly LLaMa, which has quite a low BLEU score compared to the others, suggesting that it's doing a lot more rewording than the other models. Mistral model deployment, where we can ask any psychiatric question. So first, we're just going to load the model and make sure we have the pipeline consistent with everything we've done before. This function takes a question string, queries the chain, the RAG chain, and then we'll format. This is the demonstration question we're using. A patient has some symptoms of a manic episode, impulsivity, recklessness. It started after taking cannabis to cope with losing their job and has lasted for about 3 days. So this is just a question I came up with and is something that a clinician might want to ask. And now the answers are here. So you can see this is the instructions that we gave, the template, the prompt template. And here we have the context. This is the question we asked, and here is the helpful answer. So the patient's symptoms are consistent with a manic episode. However, since these symptoms are directly related to the use of cannabis, this is substance-induced bipolar and related disorder. In this case, the diagnosis would be F15, which is the International Classification of Disease Code, cannabis-induced bipolar and related disorder. And then finally, we also include a heat map, which compares the semantic similarity of the answers between the Gemma model and Mistral. We use TF-IDF to vectorize the answers that these models produced and then compute the cosine similarity. So this is what we want to see. It's good that on the diagonals, we do have stronger similarity for matching questions. So for example, question 8, the answer created for question 8 by Mistral is very similar to the answer created by Gemma. And that's what we want to see, because it means that the models are all returning the same kind of clinical concepts, the same semantic answers, even if the styles are a little bit different.
So for precision at K and recall at K, we define the ground truth sources for each question, which allows us to check whether the system retrieved the correct document. We map each question to its correct source document, which we use later to evaluate retrieval performance. This function here calculates precision at K and recall at K. It checks how many retrieved documents are correct and whether the correct source appears in the top results. Here the results show that recall stays constant at around 76%, which means the system usually finds the correct document. However, precision decreases as K increases because more irrelevant chunks are included. This graph shows the trade-off as we retrieve more documents, recall stays high, but precision drops due to added noise. The F1 score combines precision and recall. We see the best balance around K when K equals 7 to 9. Then we go on and calculate the MRR. MRR measures how early the correct document appears in the results. Our score shows the system often retrieves the correct sources near the top. This graph here shows that performance peaks around when K equals 3, and which means that most useful results are found early. So overall, K equals 3 captures most relevant results, while K equals 7 to 9 provides a good balance between precision and recall. Thank you so much for your attention. Please reach out if you have any questions.